Regardless of any company's core business, there is much it can do to improve community health, often by supporting and strengthening the efforts of local NGOs and governments. This year, in order to better reflect GBCHealth's expanded mandate while still giving special recognition to its historical interest areas, 2 subfields were created within the community investment category. Applicants in the heritage subfield, special focus on HIV/AIDS, TB, or malaria, demonstrated exciting new approaches to these long-standing disease burdens. While the general subfield saw applicants addressing emergent illnesses such as diabetes and looking at wellness more broadly. This year's commended programs in the special focus on HIV/AIDS, TB, or malaria subfield are great examples of companies stepping up and addressing health challenges that governments were unable to tackle alone. GBCHealth proudly commends ArcelorMittal for its Fighting Malaria program and Royal Dutch Shell for its Health in Motion program. ArcelorMittal wasn't able to be here today, but I'd like to invite Oseji Okombor, Shell's VP for Nigeria and Sub-Saharan Africa, to join me on stage. Actually, sorry. I read too quickly. They're not Health challenges are not always a result of inadequate resources. Sometimes people lack access to the resources that are available. This year's winning company partnered with the African Medical and Research Foundation to provide the missing link between community and formal health systems in Uganda, improving referrals and follow-up. By emphasizing local capacity building and an integrated approach to HIV, AIDS, TB, and malaria, the program has drastically decreased the disease burden in its target districts. I'm proud to announce that the winner in the special focus on HIV, AIDS, TB, and malaria subfield of the community investment category is AstraZeneca. Congratulations to AstraZeneca and its partner AMREF for their integrated HIV, AIDS, TB, and malaria treatment program in Luwero and Kiboga, central Uganda. Representing the partnership is Professor Keith McAdam, trustee on the International Board of Directors for AMREF. Please join me on stage.
Thank you, Christy. I'm delighted to accept this award on behalf of AstraZeneca. I'd like to thank the GBCHealth Awards judging panel for selecting AstraZeneca with AMREF for our integrating malaria, HIV/AIDS, and TB treatment in Luwero and Kiboga, central Uganda, or what we refer to as the MAT project, as the winner of this prestigious award. AstraZeneca has kindly asked me to accept this award on their behalf, and I've been asked to give the following message from them. We're absolutely delighted to have won, particularly when you see the strength of the other programs shortlisted and the great things they also have achieved. We of course think the MAT project is great, but it's only been made possible by the great work of our delivery partner, the African Medical and Research Foundation, AMREF. For those of you who don't know them, AMREF is Africa's leading health development organization, saving and transforming people's lives in the continent's poorest and most marginalized communities. For us, this program has been such a good fit for AstraZeneca, where we focus much of our community investment on strengthening healthcare services, particularly amongst disadvantaged communities. The scale of the problem the MAT program is helping to address in Uganda is significant. Malaria is endemic in over 95% of the country and is responsible for 40% of the outpatient visits. There are 330 cases of malaria per 100,000 population, with treatment access at only 67%, versus the WHO recommendation of 85%. In Uganda, almost half of those infected with TB are also co-infected with HIV. Yet in 2010, only 38% of TB patients had been tested for HIV. Over the past 5 years, the MAT partnership has helped to deliver a significant improvement in TB detection, malaria and HIV testing, and HIV-TB co-infection detection. And very importantly, for the sustainability of the program, it has created an integrated management model which has strengthened health systems at the local level and created strong community-level structures for MAT management going forward. All this was made possible by many wonderful people at AMREF and on the ground in Uganda, who've dedicated their time and energies to helping those in need of better healthcare. AstraZeneca believes that real progress in healthcare can only be done in partnership with others, whether that's finding new medicines, increasing access to those medicines, or, when access is not the main challenge, helping to build healthcare capabilities for those in need in underserved communities. Thank you, AMREF, for your fantastic partnership, and to the Global Business Coalition for Health, this splendid award. Now, from me as a member of AMREF's International Board, please can I also take this opportunity to thank AstraZeneca again for their support for this project. Our organizations share a vision of better health for Africa, which began in 2004 with a much smaller project on TB in South Africa. 8 years later, it's wonderful to see our partnership being recognized through such a distinguished forum. I know the team who work on the project are thrilled by this award, as we all are at AMREF. Thank you very much.
The two commended companies in the general subfield have something in common: dedication to child health and nutrition, and a strong strategic partnership with Save the Children. Congratulations to Kraft Foods Foundation for its Fresh program, and PepsiCo for its Enhancing Life and Livelihoods program. Accepting both of these commendations is Save the Children's Director of Corporate Partnerships, Luciana Sete. Come on up. Some of the successful programs in this year's awards were small and targeted. Some were large and impressive. The winning program in the general subfield is at once tightly focused and awe-inspiring in its breadth and depth. A partnership with the International Agency for the Prevention of Blindness, the program combats preventable blindness in 17 countries and has so far reached over 28 million people, strengthening public health infrastructure, encouraging local ownership, and involving its own employees every step of the way. Congratulations to Standard Chartered, the 2012 winner in the general subfield of the Community Investment for their Seeing is Believing program.
मेरा नाम यास्मीन बेगम है। मेरा 2 बच्चा है, एक आदिल मोहम्मद आदिल, एक तो यजरीन फिरदौस। आदिल का 6 साल उम्र है, यजरीन का 10 साल उम्र है। आदिल के स्कूल में जो आँख चेकअप आया तो वहाँ बोला कि इसका आँख में कुछ प्रॉब्लम है, इसको डॉक्टर दिखाइएगा। आँख में मोतियाबिंद है, छाली हो गया। अगर नहीं कराइएगा आपका बहुत तकलीफ होगा, जैसे जैसे बड़ा होगा उसको प्रॉब्लम होगा। फिर घर में बोला तो फिर घर में भी सास बोली कि मत कराओ, बच्चा का आँख चले जाएगा तो फिर एक तो बच्चा है उसको फिर आगे धर के तुमको पछताने होगा, छोड़ दो, जो हुआ हुआ, जो होगा ऐसी तो पैदाशी है, आँख टेढ़ा है तो पैदाशी है, अगर ऑपरेशन कराया तो ख़राब हो गया आँख तो चले जाएगा बच्चा का आँख। इसके लिए हम बहुत दिन नहीं दिखाया, छोड़ दिए। कहीं दिखाओ उसको, कहीं कहीं दिखाओ आँख को, कहीं बाबा लोग के पास, वहाँ दिखाया, वहाँ दिखाने के बाद उन लोग पानी दिया पीने के लिए, माटी दिया पहनने के लिए, तब भी कुछ नहीं हुआ। फिर स्कूल में बोला, तब उसके लिए फिर आके बोला तो उसके दादी बोले ठीक है दिखाओ। फिर उसके बाद जो उसका ऑपरेशन कराने हुआ, जैसे उसका ब्लड टेस्ट हुआ, बाहर से कुछ टेस्ट हुआ, उसके बाद फिर वहाँ ऑपरेशन हुआ। कहीं मेरे फैमिली में सब कोई पढ़ा हुआ है, हम चाहते हैं कि मेरा बच्चा भी पढ़े और अच्छा से अच्छा आगे बढ़े। कहीं उसका पापा बहुत मेहनत करे, भाई लोग भी आगे बढ़ा तो मेरा औलाद भी आगे बढ़े, बच्चा भी आगे बढ़े बस।
Representing Standard Chartered is Chief Financial Officer to the Americas, John Patterson. Please join me on stage.
Thank you, Christy. On behalf of Standard Chartered Bank and our terrific Seeing is Believing initiative, it is a great pleasure and honour to be here today to accept this award. Thank you. Our latest commitment to Seeing is Believing is to raise $100 million by 2020. Standard Chartered will match dollar for dollar all global fundraising efforts until we meet that target. Lastly, a very special thanks to the judges for their recognition of our work with this award. Thank you very much.